So we will now discuss about the principles of chemotherapy, and as we go further we will see about the chemotherapy of specific diseases. So this word chemotherapy, many times we think that we associate it with the treatment of cancer. So when people are talking about different types of treatment for cancer, they say chemotherapy. So when we hear this word, we think that it means treatment of cancer. But actually, chemotherapy means the treatment of any kind of a condition by using particular chemical agents. So this word was first coined by the scientist called Paul Ehrlich, and it is defined as the treatment of specific infections using chemical agents. So whenever we make use of certain chemical agents in an infectious disease in order to destroy the microorganisms without destroying the host tissues. That is called as chemotherapy. So generally, whenever we have infection, we know that we use antibiotics to treat the infection. So chemotherapy, most of the times it includes using antibiotics. And as we already said before, even treatment of conditions like malignancy or cancer, where there is no infection, but there are abnormal cells which are growing, then in that case, that treatment is also called as chemotherapy. So broadly, if we look at it, the agents which are used in chemotherapy, the chemotherapeutic agents can be of two types. You can have bacteriostatic agents and we can have bactericidal agents. So bacteriostatic agents are the ones which only inhibit the growth of bacteria. They will prevent the bacteria from growing. Bactericidal agents are the ones which are able to actually kill the bacteria. So when we say any drug is a bacteriostat, then it will only prevent the further growth of the bacteria, but it cannot kill them. And if we say any drug is bactericidal, that means it is going to kill and destroy those bacteria. Now, another term which is very commonly used in chemotherapy is antibiotics. So these are the substances which are synthesized by different species of microorganisms. They suppress the growth of microorganisms and destroy those. So the speciality is that these antibiotics, they are not actually synthesized in the laboratory, but they are products which are obtained from certain microorganisms, and they will kill other microorganisms and destroy them. So the classification of antibiotics, if we see, we can classify them based on what is the kind of action that they have. So the first category of antibiotics, we call them as broad spectrum antibiotics. So these are the ones which will be able to act against a wide range of microorganisms. So whether they are gram-positive organisms or they are gram-negative organisms, these antibiotics will act against both categories of bacteria. So compounds like tetracycline, chloramphenicol, and cycloserine fall into this category of broad spectrum antibiotics. The second category is the narrow spectrum antibiotic. As the name indicates, narrow spectrum means their action will be limited. It is very less against only a particular class of organisms. So if it acts against gram-positive organisms, that much only activity it will have. And there are some which will act only on gram-negative bacteria. So the ones which are effective against gram-positive bacteria, examples are penicillins, erythromycin, lincomycin, vancomycin, and novobiocin. And the ones which are effective against gram-negative bacteria are compounds like streptomycin, kanamycin, and gentamicin. Then we have a third category of antibiotics which are going to act against protozoa. Protozoa are one class of microorganisms. So those antibiotics are called as antiprotozoals. So compounds like paramomycin and fumagillin, these are examples of antiprotozoals. Then we have antifungals, which are going to act against fungi. So nystatin, amphotericin B, griseofulvin, hamycin, and pimaricin. These are all antifungal antibiotics. And then we have the drugs which are not acting against microorganisms, but they are acting against the cancerous cells. So they are called as anti-cancer drugs. Compounds, these also are a type of antibiotic. Their example is actinomycin D. So whatever be the antibiotic, we know that these antibiotics are going to kill the microorganisms. So they may act by different mechanisms. and each type of antibiotic will have a different mechanism by which it is acting. So what are those mechanisms by which these antibiotics are able to kill the microorganisms? The first mechanism is that they may inhibit the synthesis of the cell wall in the microorganism. So penicillin, cephalosporin, cyclosporin, these drugs act by this mechanism. Then the second possibility is that some of the antibiotics like polymyxin, novobiocin, and nystatin, what they do is they will cause damage to the cell membrane of the bacteria. And when the cell membrane is damaged, then that cell will not be able to function in the normal way. So that is why those organisms will die. The third mechanism that is possible is that some compounds, they will prevent protein synthesis in the microorganism. Now we know that protein synthesis is very important for the organism to survive and to grow and to multiply. So if the protein synthesis is stopped, then those organisms will die. So drugs like chloramphenicol, tetracyclines, erythromycin, and lincomycin act by this mechanism. Then the fourth mechanism is that some antibiotics will inhibit, they will interfere, they will stop or reduce the synthesis of the nucleic acids. You know that there are two nucleic acids mainly, DNA and RNA. So both DNA and RNA are very much required for the cell's multiplication and growth. So if that nucleic acid synthesis is stopped, then the organisms will die. So the antibiotics like actinomycin D and mitomycin, they act by this mechanism. And the last mechanism is that some antibiotics will interfere with the steps in the metabolic processes of the microorganisms. So sulfonamides, trimethoprim, and pyrimethamine, these are all drugs which will act by this mechanism. So overall, we have seen so far about the definition of what is chemotherapy, the types of chemotherapeutic agents, the definition of antibiotics, the classification of antibiotics, and their mechanism of action. So now we have to go particularly to each of these classes of drugs that we have talked about and see little about their mechanism of action and some of the examples which are there in those categories. So the first category we will take up are the drugs called as sulfonamides, nitrofurans, and other synthetic antimicrobial agents. Now these are compounds which are synthesized in the laboratory. They are not antibiotics produced by microorganisms. They are synthesized. That's why they are called as synthetic antimicrobial agents. So out of these, one of the oldest category of drugs are the sulfonamides. So they are the antimicrobial agents which have a group called as the sulfonamide group. That sulfonamide is SO2NH2. So all these compounds, they are basically derived from one molecule called as para-amino-benzene sulfonamide. So all the drugs, they will have this basic structure, and for that there will be many functional groups and other side chains which are attached, and they are all falling in the category of sulfonamides. So what is the action of these sulfonamides? They have broad spectrum of action. They will inhibit the growth of both gram-positive as well as gram-negative bacteria. They can also act against many other organisms like actinomyces, nocardia, chlamydia and all. And they can act at uh, they can act as bactericidal agents, but that is only when you give a very high concentration. Normally, the concentration which is given of sulfonamides, the dose which is given, these drugs will have bacteriostatic action. So, coming to the classification, we can classify them based on the use and the duration of action. So, the first category of drugs, we have sulfonamides which are used for systemic infections. So, whenever there is infection all over the body, then you want to treat that infection, those sulfonamides we can use. So under that we have short acting, intermediate acting and long acting. So this is talking about the duration of action, how much time the drug will have its action. So short acting compounds like sulfadiazine, sulfadimidine and all. Intermediate acting compounds like sulfamethoxazole, sulfamoxazole, all these. Then long acting like sulfamethoxin, sulfadimethoxin. And other than this, we have sulfonamides which are used for treating only certain infections in the bowel, in the large intestine and beyond that part. So sulfasalazine is a compound which is used for that purpose. Now, what is the method by which these sulfonamides exert their action? Right. Now, all microorganisms, they have a molecule. There is a chemical compound called PABA. PABA stands for para-amino-benzoic acid. So these microorganisms use that para-amino-benzoic acid, and using that they will prepare folic acid. And to do that, they require an enzyme called as folate synthetase or folic acid synthetase. So that folic acid is very important because it will help the bacteria to grow and multiply, right? So if you want to kill the bacteria, then what you have to do is you have to prevent this formation or synthesis of folic acid in the bacterial cell. So for that, we make use of sulfonamides. These sulfonamide drugs, their structure is similar to that of GABA, and because of that they will bring about competitive inhibition of that folic acid synthetase enzyme. So what will happen is the enzyme will combine with the sulfonamide drug instead of combining with PABA, and because of that there is no production of folic acid. Some other compound is synthesized, and because folic acid has not been produced, then the bacterial cells cannot use the folic acid, and because of that they stop growing and they will die. That is how these sulfonamides exert their action. Now, the sulfonamides which are meant for systemic actions, they should be well absorbed, and they will get absorbed from the GIT so that they can reach the site of action. The ones which are meant to be used only for bowel diseases, they should be non-absorbable, and they will be staying only in the intestine and exert their effect there. The uses of sulfonamides, they are commonly used to treat several conditions like acute bacillary dysentery, ulcerative colitis, urinary tract infection, meningococcal meningitis. They are also used in treatment inclusion conjunctivitis and trachoma, and to prevent in prophylaxis of streptococcal tonsillitis. Now they are useful, no doubt, but they also have some adverse effects. Like most of the sulfonamides, they cause allergic reactions, which may show up in the form of fever, skin rash, and so on. Some of them can cause what is called as crystalluria. So when these sulfonamides get metabolized, they form certain crystals, and those crystals will get precipitated and appear in the urine. Then they may have adverse effects on the bone marrow also. So hemopoietic toxicity can be there, like you can have patients suffer from agranulocytosis or from thrombocytopenia also. And then there are some miscellaneous kind of side effects, adverse effects, like some people may suffer from hypothyroidism, some people may suffer from goiter, some people may rarely have psychotic episodes using the sulfonamides. So tablets are given. Most often these are given orally as tablets. Then we come to the other drug, which is a combination. So there is a drug called as trimethoprim, and there is another, it is combined with another drug. So this trimethoprim is actually a molecule which is derived from pyrimidine. Now it has bacteriostatic action. Okay, that means it cannot kill the bacteria, it will only inhibit their growth. So it can be used against organisms like Streptococci, Staphylococcus aureus, E. coli, Salmonella, Shigella, and Proteus. Right. So what happens is that if you combine this trimethoprim with sulfonamide drugs, then that combination is what is called as cotrimoxazole. Okay. So here, what is the purpose of combining it? They have found that when you combine both of them together, there is what is called as synergistic action. If you remember, synergistic action is when the action, the final effect of giving two drugs is greater than the sum of their individual effects. So here, when you combine trimethoprim with sulfonamides, the trimethoprim is actually bacteriostatic. Sulfonamide is bactericidal in higher dose. But when you combine them both together, definitely there is bactericidal action. So how does this combination act? Now we have already seen that sulfonamides are going to prevent the conversion of PABA to folic acid. This trimethoprim, what it will do is, it will prevent the action of activation of folic acid to form tetrahydrofolic acid. Now, the bacteria, they need to produce folic acid, and they also need to activate the folic acid by converting it into tetrahydrofolic acid. So the sulfonamide will prevent synthesis of folic acid, and the trimethoprim will prevent the activation of the folic acid. That is the reason why when both these drugs are used together, they have very strong action and they will completely stop the growth of bacteria. So this combination called cotrimoxazole is very useful. So they often ask in the exam that write a note on cotrimoxazole. So if that is asked, you have to describe what is the meaning of cotrimoxazole, what is its mechanism of action, and how it is having particular uses. So this cotrimoxazole can be used to treat infection caused in the urinary tract by organisms like E. coli and Proteus. It can also be used to treat what is called as bacterial prostatitis. Prostatitis is the inflammation and infection of the prostate gland. So whenever there is infection there, we can use cotrimoxazole to treat that. Then, when if somebody is suffering from gastroenteritis, which has been caused due to organisms like E. coli and Shigella, we can use cotrimoxazole. And certain types of respiratory infections, gonorrhea and typhoid fever, they use this drug, this combination. However, it does have some adverse reactions, like it can cause nausea, vomiting, and skin rash. Then some people suffer from anemia, leukopenia, thrombocytopenia, such hemopoietic side effects. Then some people will suffer from stomatitis, which is infection or inflammation in the stomach. Glossitis, which is like the tongue will become thick and rough and inflamed. Crystalluria, crystals will form and they will get excreted through the urine. And the main thing is that this cotrimoxazole has teratogenic effect. So it will exert a toxic effect on the fetus which is growing within the pregnant woman. So it should not be administered to pregnant women. Then the next category of compounds are the nitrofurans. So these nitrofurans, they are also synthetic antimicrobial drugs, and the main use of the nitrofuran compounds is as urinary antiseptics. So, what is a urinary antiseptic? If you want a drug, when we are saying antiseptic in general, we mean that it is an agent which is going to kill the microorganisms, right, in a living being on an animate surface. So, when we use something to destroy the organisms which are growing in the urinary tract, then that drug will be called as urinary antiseptic. So, if people are suffering from urinary tract infection, if there is bacterial growth anywhere throughout the urinary tract, then we can use these nitrofurans as urinary antiseptics. The most commonly used drugs in this category are compounds like nitrofurantoin, nitrofurazone, furazolidone, and nifuroxime. So these drugs, depending on the dose in which you give them, they will have either bacteriostatic action or they will have bactericidal action. So in low dose, at a low concentration, they will have bacteriostatic action. They can only prevent the growth and multiplication of the bacteria. In high concentrations, they will kill the bacteria and act as bactericidal agents. So these drugs are effective against a wide variety of gram-positive, gram-negative organisms. They can also act against protozoa like Trichomonas vaginalis, which is found in the vagina of women. It can also act against fungi like Candida albicans. So whenever you know that the infection in the urinary tract has been caused by any of these organisms, then we can give these nitrofuran molecules. So what they do is they will act on the microbial DNA and damage the microbial DNA. So if DNA is damaged, then DNA replication cannot take place, then protein synthesis cannot take place, and the microbial cells cannot grow and divide. So because of that, they will not be able to increase in number. So the main use, as we said, nitrofurantoin is used in acute urinary tract infection as well as in chronic urinary tract infection. Acute urinary tract infection means sometimes a person may suddenly develop the UTI, and chronic means all the time the person will be having urinary tract infection. So there are certain adverse reactions of these drugs also, like they can cause gastrointestinal disturbance. Some people suffer from nausea, vomiting. There can be skin rash and polyneuritis. Then these drugs also lead to some kind of folic acid deficiency. See, they are acting on the microbial DNA and they are damaging the microbial DNA. Similarly, they will also damage the DNA in the host cells in the person who's taking the drug. So because of that, there can be mild deficiency of folic acid, and that if it is there, it can lead to the condition of megaloblastic anemia. Then it can also cause hemolytic anemia in some people. So these sulfonamides and nitrofurans, they are actually compounds which were very useful until quite a few years ago. And because we had no better molecules, we were using them. But now that there are many safer alternatives, we have better antibiotics where the action is stronger and the adverse effects are lesser. So then these drugs are not used very often except in very specific cases when the doctor feels that yes, this drug has a definite advantage. So this is the first part of the chemotherapy chapter. So we will, in the next class, we will go ahead to the remaining parts of this chemotherapy.